My name is Diana, and I'm Batgirl.
Batgirl, 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 Batgirl.
I developed Batgirl to talk to you guys about degenerative disc disease. Also, because I can't handle how crazy this disease has been for me, and I'm sure for the rest of you. So to keep myself from taking it really seriously, I am totally doing it with a mask on. And the mask is obnoxious, and I hate it already, but I'm gonna keep it on, just for you guys. Degenerative disc disease is kind of like saying you have acne. A lot of people in the population get it. It's kind of a form of aging. The discs in your spine wear out, they rupture, they herniate, you could get really intense back pain. It comes and goes for some people. You can get sciatica, which is pain down your legs and your arms and your neck. It's the worst. Some people walk around with herniated discs and not even know it, which is awesome. And I'm really proud of you guys. For the rest of us who have herniated discs or ruptured discs, most of us are acutely aware of how terrible it is. I was 14 when I got my first spinal surgery. I know, it sounds crazy, but I did it. We're not really sure why my spine got so bad so young. I was involved in gymnastics. My family seems to have like some sort of congenital leaning or bend towards having back problems. A lot of us do have back problems at a very early age. But I tell you, 14, starting with my first L5, S1 lamenectomy discectomy was no fun. I started high school with like, I think something like 50 staples down my back. And I got thrown into a locker the first day, and I remember they like broke. And it was stressful. And when I turned 18, I had my first L4, L5 surgery. So that's pretty exciting. Not at all. So when I was 23, some of the pain came back. I just moved to a new city. I was under a lot of stress, and I worked hard with yoga and a couple other things, and I managed to actually get rid of it. And the symptoms went back, the sciatica stopped happening to me, and I was good until I was about 26. I organized a giant Snuggie Pup crawl in the city that I lived in, and then promptly got another surgery, the L4, L5. It was, and the doctor said, he was like, this is not going to be stable, like you're going to end up getting a fusion, and I spent 4 years trying to avoid it. I turned 30 4 months ago, and I got an interbody, dual level, super awesome spinal fusion. And by super awesome, I mean a sucktastic adventure that I'm so happy to share with you. Mostly because back problems and spinal surgeries are complicated. And there are some people out there who have amazing stories, and other people have terrible stories. And I think my story is somewhere in the middle. And I think a lot of it is your attitude, absolutely, and your coping mechanisms. And I've had a lot of years to think about this, so I have a lot of interesting coping mechanisms. So I'm going to share them with you. Maybe it'll help, maybe it won't, but I just want you to know about it, just in case it does. And to also prove that, as an extreme case like myself, we're gonna be fine. Even if I can't feel my feet anymore, which I can't, we're gonna be fine. So I hope these videos help you. The next one will be about the treatments that I went through. Might be boring, but I'm wearing a mask the whole time, so maybe not so boring. I'll see you soon.